Good morning. This is Paul Rothman, and I'm here this morning with Dr. Lisa Maragakis. Good morning, Lisa.
Good morning, Paul.
We're here to talk about where we are in this pandemic and some of the big issues that we're still facing. You know, it's been 8 months since this pandemic began, and some things have become very clear. First of all, this is a very infectious virus. 2 is that we know if we protect ourselves and our patients, the virus doesn't spread well. And 3, we're all getting a little bit tired and getting a little bit of virus fatigue. Lisa, tell us the most important things that we can all remember to help stop the spread of the virus.
Absolutely. And you're so right that we all have pandemic fatigue. So it's easy to forget about the very basic things that help to keep everyone safe. And those really are physical distancing, keeping space between ourselves and others, wearing masks, cleaning our hands, and staying home when we're not feeling well.
So let's go through this. Let's begin with masking.
You know, the data show that wearing a mask protects other people around us, but it also protects ourselves. So we're learning more through the course of the pandemic. So in order to protect ourselves and others, it's important to wear a mask whenever you're around other people. When you're alone in your office with the door closed, you don't need one, but otherwise, I would say wear it and make sure it's covering your nose and your mouth.
So let's talk about physical distancing. It's 6 feet. Do you have to wear a mask if you're 6 feet apart?
Sure. So the recommendation is to do both physical distancing and wearing a mask. They're really not something that you can substitute one for the other. So we should wear a mask whenever we're around others and try to maintain at least 6 feet between ourselves and other people.
And tell me a little bit, it's hard to eat with a mask on. What are we advising people to do when they have to eat?
So of course you have to remove your mask, sometimes just to get a break from it or to eat or drink. And this is a time to be especially vigilant and make sure that you're not too close to other people. So we have seen, particularly in break rooms or during lunch or mealtime, is a point of risk. So it's a time to make sure there's not too many people in a room and that we stay away from others.
And washing hands. I remember it's 20 seconds. I always tell people it's singing happy birthday to yourself twice to wash your hands. And we find that that's another key part of infection control. Am I right?
It always is. Hand hygiene and cleaning your hands either with soap and water or with an alcohol-based hand sanitizer is one of the best ways to protect yourself from any infectious disease, but especially now during a pandemic.
So I see when I log in on my computer, I have all these checks. Tell us a little bit of our health checks and how people should think about those and when they should do them.
That's another important piece of what we're doing to ensure that whenever we arrive at a workplace or a school, there is a checklist essentially to make sure that that individual is not having symptoms and has not been around somebody who has COVID-19 at home, for instance.
Great. So it's time to remember all these things. We've been doing them 8 months. They work. We know that if people adhere to these 4 simple rules, that they work, and we don't spread the infection either to the patients, from the patients, or between our workforce. So again, we want to thank everyone for their hard work and effort. Thank you, Lisa, for all the work you've been doing this pandemic. And please, everyone, let's keep safe until we get an effective treatment or vaccine for the virus. Thank you.